Hey everybody, it's Dr. Aline Potvin. Thanks for joining me again for another installment of Wellness Ed Sunday. I hope you all have been having a really good weekend. I have been kind of gearing up for those of you that don't know, I actually teach science classes and oftentimes health science classes on the side, and so there's periods of time where I'm kind of in between semesters and I'm hopping in and starting a new semester for one group, but also I will be ending a spring vacation for another. So I'm kind of getting back into teaching mode. So this is kind of a perfect warm-up for the start of my week. One thing that has been coming up a lot more in the news lately, and I keep up with that stuff not only for practice but also for teaching in general. I like to bring in current events and new things that are popping up in terms of scientific understanding of how the body works, etc. So one thing that's really been popping up a lot lately is the standard for measuring or estimating risk of heart disease. One of the things that we do measure to do that is cholesterol. And there's actually been a lot of debate lately about whether or not cholesterol is a good predictor of heart disease, like we have thought it has been for a long time. What we're starting to understand is that it may not necessarily be as predictive of heart disease or risk of heart attack like we had thought before. And if we understand that how cholesterol actually ends up in our artery walls, it actually makes a lot of sense. So there's actually a series of steps, and I'm going to break it down, try to simplify it as much as possible. The steps where we go from cholesterol that's hanging out in our bloodstream that will ultimately end up lodged in an artery wall, causing a blockage, which is what heart disease is and can lead to a heart attack. Now, the thing is that cholesterol, even if it's floating around in the bloodstream, doesn't necessarily end up creating a plaque or end up in the artery walls, which is the concerning pathology. What actually has to happen first, before that cholesterol can even end up in that space, is that the inside of the blood vessel actually has to get damaged in some way. And this can happen for a number of different reasons. You can have high blood pressure that causes very small micro damages to the inside of the blood vessel. You can have conditions like diabetes or other what we call fibrotic conditions that damage soft tissues like autoimmune disease. Those kind of conditions actually cause damage to that inner lining of the artery. So when that happens, you have this inflammatory response that occurs. It's just like, getting a cut on your skin or anywhere else in your body. There's going to be an inflammatory response to that tissue damage. So that means you're essentially having an immune response. Your body wants to heal up that micro damage that's happened on the inside of the vessel. And so you're going to have your immune system coming in to try to patch that up. This is where the cholesterol can kind of, it's not choosing to do this, but what can happen is that cholesterol can get trapped and oxidized and trapped by the immune system and get lodged inside that part of the blood vessel where the damage has occurred. So you actually have to have damage to the blood vessel that happens first, and then cholesterol has to be oxidized and trapped by immune cells, which solidifies it and makes it sit on the inside of that blood vessel. At some point, maybe I'll pull out a whiteboard and draw this out for another video. But what I'm trying to explain here is that there's a few things that have to happen first before a plaque will actually form in the inside of an artery. And it's not necessarily the amount of cholesterol that's present that will influence whether or not the plaque forms. There has to be some prior damage to the inside of the blood vessel, and there has to be some sort of oxidation, and that means the cholesterol essentially goes rancid. It's exposed to oxygen and changes formation before it actually can get trapped and put into the blood vessel wall. And that leads us to other considerations in terms of treatment and prevention of heart disease, because first of all, there's a lot of things that you can do to help reduce risk of the blood vessel being damaged in the first place. Usually that's paying attention to lifestyle and diet, which can influence things like blood pressure and risk of diabetes, and other things that can damage the inside of a vessel wall, like smoking, for example, is another thing that will influence that. So reducing those kind of risk factors is actually very much primary prevention of the formation of plaques and clogging of those arteries. Trans fats are another thing that can actually damage the inside of the blood vessel. So reducing our risk of damage to the inside of the blood vessel is really key, but reducing the risk of that cholesterol that is present in the bloodstream, actually reducing the oxidation of that. Oh, I see a question here. That's a really good question. So what Michelle's asking is whether or not dairy can play a part in this, and whether or not foods that have high amounts of sodium. So that's a really good point. There's actually a lower number of people that are salt sensitive than we actually, oftentimes what people will be told when they have high blood pressure is to reduce or cut out a lot of the salt in their diet. It's not everyone that actually gets high blood pressure when exposed to salt. So for some people, certainly, drinking or eating canned foods, which are really high in sodium, could up their blood pressure. What may be more concerning in the canned soups and the processed foods are other additives that actually could cause inflammation or damage to the inside of the blood vessels. Dairy kind of can act by the same way. It's actually potentially less of a concern that there's saturated fat in the dairy. We've kind of vilified, butter and dairy fat in a lot of ways, when in reality that may not contribute to high cholesterol and heart disease as much as perhaps sensitivity to dairy. So when somebody has a low-grade immune response to dairy, that can cause inflammation, which damages the inside of the vessel. So there could be an indirect contribution there. But the relationship between dairy and saturated fat and heart disease, that's a whole other thing that we could talk about. It certainly is something that a lot of people are confused about as well. So if we want to reduce inflammation and reduce chronic inflammation and damage to the inside of the vessels, there's a lot of diet and lifestyle considerations that you can kind of keep in mind. And the second thing that I mentioned was, how do you keep that cholesterol that is, in the bloodstream from getting oxidized, which is kind of that first step to the white blood cells taking it and putting it into the vessel wall. Well, there's a lot of fat-soluble antioxidants that we get in plant-based foods. Vitamin E is one. It's a fat-soluble vitamin, but it's also a really nice antioxidant. And so when we eat, a reasonable amount of, or largely plant-based diet, we do get a lot of these fat-soluble, and they need to be fat-soluble antioxidants to be more effective in this case where you're working with another fat like cholesterol. So, this is part of the reason why incorporating a lot of fruits and vegetables into the diet and, healthy nuts and seeds, that's part of the reason why that helps reduce risk of heart disease, is that antioxidant factor. So, to really look at heart disease from a holistic perspective. We can't just look at a number, a high number, especially a high total cholesterol, and see that as a risk factor, because there's actually a variety of other steps that contribute to the formation of, plaques inside the arteries of the heart and the risk of cardiovascular disease or risk of heart attack and stroke. So, including, lots of fruits and vegetables into the diet is really key. Reducing risk factors that cause overall inflammation in the body. So taking out, things like smoking, obviously that harden the arteries, helping reduce blood pressure and maintain it at a healthy level over time. Because any kind of chronic inflammation can cause damage to the inside of those vessels over time. Not only that, but chronic inflammation also can make our cholesterol rise over time. Cholesterol is something we actually really need structurally in our body. It is used for the production of lots of hormones, and we also have it incorporated into all of our cells, the membranes of our cells. So if there's inflammation, our cells get kind of leaky, and that makes cholesterol go out into the bloodstream. So sometimes high cholesterol is actually a symptom of a larger issue that's going on, but it won't necessarily put somebody at risk for heart disease or stroke. What will contribute even in even greater amounts towards that plaque forming in the artery will be the oxidation of that cholesterol and the damage to the inside of the vessel. And absolutely right. So Michelle mentioned the exercise. So exercise is wonderful because it obviously keeps our cardiovascular system in check and in good practice, but it's also a really great anti-inflammatory if done, not in extreme amounts. There is a little bit of inflammation that happens just after we exercise because, our muscles are repairing. But generally speaking, consistent, regular exercise and movement will reduce that risk of damage to the inside of the vessels. So, when we talk about reducing risk of heart disease and reducing people's risk of heart attack and stroke, there's, a lot of things that we look at in terms of markers. Cholesterol is a really big one that we get very fixated on. And, it's not that cholesterol has no influence on risk, but it may not necessarily be as much of an indicator of somebody's risk of heart disease than some of these other things that, we don't necessarily even have, we're not watching those markers as closely as cholesterol. Inflammatory markers, for example, are something that we can pay attention to, and also how you just generally feel. So those are some considerations that I try to, help people understand when they come in very concerned about cholesterol levels. It's something that we need to watch, obviously, but I also look at cholesterol and naturopathically, we look at cholesterol as typically a symptom of a larger process going on, usually of a larger inflammatory process. So to really help that person reduce their risk of heart attack and stroke, you have to help with that and, reduce that inflammation just as readily as you have to help reduce, focus on the cholesterol. And sometimes just reducing the inflammation and helping normalize other systems will bring that cholesterol down on its own. So if there's any questions about that, you can certainly, write some below. I'm going to sign off for tonight, but that's just some food for thought as you start the week. If cholesterol is something that's a concern for you or you've been concerned about in the past, this is, some food for thought as you're creating a health plan for yourself and working with your providers. But I hope you all have a really great week. And I will see you all again next weekend. But tomorrow happens to be the first day of spring, so I hope you guys have a great time, and we can expect delightful, wonderful, longer days from here. So take care, everybody. Have a good week.